Hello and welcome to the day's episode of Focus Atlanta. I am your host, Keisha Lance-Lynn. Thanks so much for tuning in with us this Sunday afternoon. In our first segment, we're going to talk a little bit about social media and its effect on our mental health, especially when it comes to kids and teenagers. I'm here with Dr. Ataga of the University of Phoenix. Thank you so much for coming on the show. It's a strange topic for those of us who are a little older and out of the loop, right? Because we didn't have social media back then. We weren't tied to it as emotionally as children are today. What should we know?
When I'm working with parents or just with adults who have teens, that one of the first things I tell them is that we have to have social media literacy. Social media constantly changes. There are new additions and apps, and it's important that guardians and parents try to stay as up to date as possible.
Okay. When we're talking to our students, when we're talking to our kids about their use of social media, we don't want to be, I guess, too strict, because sometimes that pushes kids in the total opposite direction of where we want them to go. Are there any tips about how we can engage them to make sure that they're safe?
Well, first thing I always tell parents is have a conversation. What apps do their teens want to use, do their adolescents want to use? What apps are their peers using? And then from there, let's speak about boundaries. So if a parent decides that it's okay for their child to be able to use social media, it's also important that that parent either have the password, know how to properly use the app with them, have them as a friend, in order to make sure that they can keep an eye on the teen, because we want to keep interactions safe and healthy for that teenager.
And I think that's the biggest thing, safe and healthy. I think as adults, the safety is the first thing that we think about, right? We're like, oh my goodness, is this a safe platform for them? But the mental health aspect of it is so important too. Is there a way to kind of stress that to both the guardians, the parents, and the children?
Oh yeah. So let's go ahead and have these conversations. There's going to be a lot of comparison. You're going to see peers get accolades and get achievements that maybe the teen wanted for themselves. Most importantly, there may be people try to contact you that should not be in contact with you. So I always tell the parents, establish what is allowed, and then most importantly, have a day away from social media in order to promote self-care, but also to make sure that there's not a sense of addiction, that the teen feels like they have to be on social media 24/7.
Oh, I love that. I love that. I don't think that I had actually considered that, at least a day away. And again, that way you can kind of, because I guess the other thing is, how do parents know, right? Like, we're not with the kids 24 hours a day, and so you're wondering, you don't know what that attachment is like. But if you set that ground rule that there's at least one day, you kind of have some kind of gauge of, how they are living with this, experiencing it, having it in their lives. And, isn't that really kind of a helpful way for parents as well? Because again, since they don't experience it, how do they know how it's affecting their children? You know what I mean?
Exactly. And when there is that lack of experience, that creates that loophole in order for the teen to be engaging with social media in a way that may be harmful to their mental health. So parents often ask, well, if I establish Sundays or Saturdays, no social media, how do I know they're not going to get on their phone and actually use it? Do something with your teen. Take them out. You can remove the apps or lock the apps and just tell the teen, this is a day for you and I or the family for us to engage in self-care, and we're all going to be pulled away. I'm not going to even get on social media. And if the parents are on social media, they can say, I'm not going to even be on my phone a lot. So you're demonstrating for the team healthy boundaries, and you're also giving them another outlet. Because guess what? When teens get bored, they go straight back to the phone. But if you provide them an outlet to be able to use, then they don't feel as engaged. They can still take pictures on your phone, and you can say, you can upload this tomorrow. You can speak about this tomorrow. But let's just disconnect to connect.
Disconnect to connect. Oh my gosh, that is so helpful. Thank you so much for coming on the show. Thank you for sharing these tips with us for our teens, for our parents, and for the betterment of all of our mental health. We appreciate your time. It was good to meet you.
Thank you. Great to meet you all too.
All right, guys, those are fantastic tips. Please take the opportunity to implement them in your life. These are just small ways, small things that we could do to help, one, reconnect with our children on some level, and also to maybe pull them back from what may be the dangers of social media. Thanks so much for tuning in to this segment of Focus Atlanta. We'll be right back with more.